Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, GL 30A, Section 18, and the governor's March 15th, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the Westborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the Town of Westborough's website at town.westborough.ma.us. For this meeting, members of the public wishing to watch the meeting may do so in the following manner: on westboroughTV.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of Westborough's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. With that, I call the meeting to order. First item on the agenda is review of the minutes from September 15th. Any questions about them?
I make a motion that we accept the minutes for September 15th, 2020.
Is there a second? I'll second it.
Sorry,
Okay.
sorry, I was on.
That's okay. As long as you're on, we'll do roll call vote. Dr. Hashmi?
Yes.
Dr. Walsh?
Walsh, yes.
Dr. Ehrlich? Yes. Okay, next up is the director's report. I have no questions.
Give me a sec to skim over. So on there was the discussion of the master plan, and I have not been able to attend many of the master plan meetings lately. And I was wondering, can you give a quick update as to the status of where the master plan is in regards to the Board of Health?
Yeah, so we had a meeting, maybe it was 2 weeks ago. So the public health subgroup, which basically was me and Jody that met, we put together a list of issues and opportunities was what we had to submit. So we did submit those. I'm unprepared. I think it had something to do with issues where, community health, things like Lake Chauncey was an issue, trying to reaching out to senior population was an issue. Those are the types of things we listed as issues, walkability of the town, things like that. And opportunities, we just listed some things on that. I can get you that, Nathan. I'm sorry, I don't have it in front of me.
No, they all sound like very reasonable things and stuff we've been pushing as a board, so good. Yeah. And are we going to talk about the contact tracing later on, or do you want to do that now? I just kind of wanted to get some feedback. I know that we've been leveraging the contact tracing collaborative, and just kind of want to get your feedback as to whether that's working well or whether we need to, try to double down and get more resources that are just specific to Westborough.
Yeah. So, I mean, as far as utilizing the CTC, we haven't had to utilize them all that much. I've kind of been just trying to use them for when we need interpreter services. Okay. Ray and I and Erin have been trying to handle the bulk of the tracing in-house, just because we have more control over what's going on, have better real-time data, that sort of thing. So I haven't we had to refer one to them today, and they reached out quite quickly, actually. So we're not using them a whole lot just because it's just easier to keep it in-house, but they're there in case we need them.
Okay. Good.
Any other questions on the director's report? We have a motion to accept?
We accept the director's report for September 2020.
Hold on, it's said. And the Complete Street group, how's that getting moving along, Steve?
Yeah, we have a very kind of minor role in that. I've been participating in the meetings, but not really all that much input. It mainly has to do with more of infrastructure for sidewalks and other things on that. So it is moving forward. Chris would be a better person to talk to about that, say it as far as specifics. But they've identified certain areas of town where people have commented on as far as improvements that could be made, whether it be better crossing areas or.
I just wanted to make sure that the group knows that the board, as I think it was Nathan that originally suggested it, is very invested in this process. That's all right.
Yeah,
I hope I'm not misquoting the board. Right? We are. Yes.
No, we want the better walkability of streets. I think everyone's on board.
Okay.
Agreed.
So I guess I'll just sum up. It's moving along. That's our second meeting we've had, and right now we're just trying to identify what areas to address. There's a limited budget and all that goes along.
Of course. I just wanted to just make sure that people know that we are interested.
Yep.
Okay, so we have a motion on the floor. I just need a second. Which I'll
yes,
second.
I'll second it. I'm sorry. I'm
Okay.
being kind of dense today. Please forgive me.
All right.
Sorry.
Any further discussion? All in
No.
favor? We'll start with actually Dr. Hashmi,
Yes.
Dr. Walsh,
Walsh, yes.
and Dr. Ehrlich. Yes. Okay. Next up is Sanitarian's report. I actually
Wow.
didn't have any questions. There was one typo. It would be nice just fixed for the permanent record.
Could we?
Under Westborough Toyota, he will look into the issue.
Can you summarize the COVID-19 discussion?
Ray, you see what I'm talking about just before we move on? Okay. All right. Go ahead. What specifically you're asking about COVID-19?
The CTC was. I mean, could you give a summary of about what happened with Cumberland Farm?
Yeah. Who wants to take that? Ray
this
or
was a
Steve?
call that we got from CTC.
Sure, I could start. And Ray, please jump in as you see fit. So we were contacted by the CTC regarding a cluster at the Cumberland Farms warehouse on Flanders Road of workers that work in the freezer area there. Those workers did not reside in Westborough, but the CTC was doing contact tracing for another town where they resided. They all worked in the same area. So there was a little concern about whether, what type of control measures that Cumberland Farms had in place. Dr. Ehrlich made a very good suggestion that we have a meeting with him, myself, and Ray, and their safety officer for the facility. We spoke about their control measures, and there are other circumstances that maybe had exasperated this, is that many of those workers, they drive in together because they live in the same town. It wasn't clear that anything that Cumberland Farms was doing was either contributing to it or causing it to be worse. So at this time, as far as I know, all those have recovered. Again, these are not Westborough residents. If Dr. Ehrlich or Ray want to jump in, that's fine at this point.
I'll add a couple things, unless you want to go first, Ray.
No, I think Steve covered it. I mean, I have a good working relationship with the COVID safety officer up there, and we've been in contact since you and I spoke the other day, Dr. Ehrlich, and nothing else is going on right now. So I think they have a good plan in place, and as long as they follow their plan, they should be all set.
Yeah, well, I'll add just a few bits for the other board members. So the call went well. It was constructive. We really covered a wide range of things to make sure appropriate measures were in place. They're doing screening at the factory gate or the entrance to the facility so that they're able to try and send people home who either have symptoms, have a fever, or have some other reason why they should not be at work. So subsequent to that call, we were contacted by the city of Worcester. So all these people live in Worcester. They carpool together. From what we understand, they're friends and they hang out together. So it's not surprising that you'd have a cluster amongst this group that's spending a lot of time together. If you get one or two people who have it, it's going to spread. we did get contacted by the Worcester Health Department because they obviously are getting it reported as a cluster of their citizens, and they know from their contact tracing that all these people work in Westborough. And so we had a very constructive call with them. We reviewed what we had done. They were very happy that we were on top of things, and had really nothing to ask. They were more just doing their due diligence by checking in with us. And we agreed to remain in open communication if there are further developments. So just sharing that. And I don't know if that second call probably happened in October and will appear in the October report, but it's just worth you hearing about it now.
Thank you. Just a piece of business, the new restaurant that's looking like it's looking for a place, the new Asian fusion restaurant. From the sounds of it, it sounds like things are going well. Any progress from when you submitted this, or that's where it stands right now?
It's kind of dead in the water. We haven't heard from anything. They were supposed to submit some stuff to me and Lisa so we could go over the grease trap requirements, and we haven't heard from them since. So it's kind of dead in the water.
Where is 22 West Main Street?
Do you remember the subway was near the town hall?
Yes.
2 doors closer to the Rotary.
Okay.
So right in that line of buildings there.
Yeah. Thanks. All right. Any other questions for the Sanitarian?
I make a motion that we accept the Sanitarian's report for 2020, unless, of course, there's more discussion.
I'll second. Dr. Walsh?
Walsh, yes.
Dr. Hashmi?
Yes.
And Dr. Ehrlich? Yes. All right. I'm not inclined to start the health inspector's report where it's 5:43 already. I think it might make sense just to get on with the fall implementation of modified sports. I don't think we'll be making any decisions in less than 2 minutes, so anyone who joins will hopefully get the majority of what we're going to be discussing. So I don't know if Amber is on the call. I do see Joanna DiCarlo, so I'm going to call on you to perhaps kick things off for us.
Sure, it'd be my pleasure. I want to, first of all, thank you all for having us on tonight. And I know I've been working pretty closely with Steve Bakari, as closely as we can virtually, I guess, Steve, because we've never actually met in person. As the summer was sort of rolling on and we started to welcome kids back to campus and have them start to look to get involved in fall activities again. So we've provided Steve with our implementation plan for what we're doing right now in fall sports. And when I had requested this meeting, one of the things I was wondering about is, what would we do as we start to get kids or staff members with positive tests, and how would we manage when to shut teams down and all that sort of stuff. And in all honesty, we've now been doing this for about 3 or 4 weeks, and we seem to be managing it, I think, pretty well in terms of when we've had a case at the high school or a student at the high school that has tested positive or has had to quarantine for being a close contact. Our nurses and our athletic trainer are doing a great job sort of tracking all of that information. So I'm hoping that you all feel as if we've got things sort of under control at the high school in terms of the fall athletics programs. So I guess what I'll be looking for tonight is just sort of your thoughts on how things have been going. If you've heard anything in the community, I can give you a quick update about what we've been doing, and then sort of starting to look ahead to the winter, which our winter seasons are set to kick off anywhere between November and December. So first of all, starting off with the fall, I did provide a report that was a combination of our league and some other leagues in central Massachusetts that came together to develop some protocols about how we would run our high school sports programs. And those protocols were really based off of the guidelines that the EEA and the governor's office had handed down to us in the middle of August. So we've been modifying our sports. Currently, right now, we're playing interscholastic sports in boys and girls soccer, field hockey, golf, and cross country. And we're competing in a 5-team pod with Wachusett, Leominster, Algonquin, Shrewsbury, and Westborough. The 2 other sports that traditionally are played in the fall are football and volleyball. And the state has not cleared football in order to start competing yet. So they moved that to what we're calling the fall 2 season, which will be in February, March, and April. And with volleyball, that was cleared, but we weren't sure here at the high school if we were going to need the gyms for other purposes, whether or not we would need them for classrooms or cafeteria space. And so the MIA, which is our Interscholastic Athletic Association, allowed us to move that sport to fall 2 as well. So we currently right now are competing those sports. We're practicing 5 days a week. We've got about 380 kids right now at the high school involved in after-school athletics between all of the programs. We're playing 8 game schedules against those schools that I mentioned. And we're wearing masks all the time. The kids have to wear them while they practice and while they play, doing all the hand sanitizing protocols. And we basically are only allowing about 50 spectators into the facilities to watch the game. And they're only our home spectators right now. So that's sort of where we are right now in the fall. I'm not sure if anybody has any questions for me about the fall sports or any sort of suggestions for us and how we sort of continue.
I mean, I just kind of wanted to reiterate some of the safety measures that have kind of been put in place. I think the fact that we're playing a limited number of teams and it's the same teams kind of in all of the sports that we're playing that we're doing really does reduce the risk. And I think that having most of these sports being outdoor sports also greatly helps in terms of, lowering the risk. And I do think that our high school students are actually doing better than a lot of other high school students, although maybe Steve will correct me if I'm wrong. But it does seem like we're doing pretty well in our high school. So I think those all bode well moving to the winter. Some things change as we look at the winter sports, though. And particularly that's I think what we have to kind of to focus on a little bit.
Sure. So how we've operated the last few months is the guidance has come down from the state, and I've sort of put together a proposal for Steve and for Superintendent Bach to say, here's what the state is telling us we're allowed to do, and now I'm sort of looking for local guidance and local approval in order for me to implement these things. So if you're all comfortable, I'd still like to probably take that approach moving into the winter. The tough part for us is that things move so quickly. The state moves very slowly, and then it's expected that we move very quickly. So right now, I'm actually sitting on a task force in the morning with the MIAA and some of the representatives there, and we'll start to have some of the conversations about the winter. And the EEA is expected to drop the guidelines for winter sports for us the first week of November. So depending upon where your timeline as a board falls, I would be more than happy to come back to the board, or I can continue to pass documents through Steve the way that I have since probably June.
So I want to just pause. Welcome, Amber.
Thank you. I'm sorry. I got
No
hung
problem.
up on the call. Apologies.
Yeah, no. So what's happened so far in this discussion is that Joanna has been sort of outlining what's going on, and there have actually been no questions from the board yet. So you've not missed anything that you don't already know. Okay.
I knew you were in good hands because I knew she'd be right here starting. So thank you.
Yep. Okay, so it sounds like you sort of laid out the background. Do you want us to just make comments or ask questions at the moment and start a discussion? Would that be best?
Sure. The one last thing I'll say too is that, as I'm sure you're all aware, that the winter is going to pose a myriad of different complications, whether it's being indoors. I know Dr. Ehrlich, that you mentioned that it's nice to have the limited number of teams, or Dr. Walsh, I think maybe that was
Dr. Walsh. Yeah.
Yep. That we're hoping to continue that in the wintertime. The different sports create different difficulties in order for us to do that. The sports that compete in gymnastics, or the schools around us that compete in gymnastics, will look very different than the schools that compete in ice hockey. We're not going to get that same sort of balance and nice, clean pods the way that we have in the fall. So that is certainly one concern of mine. And then, like I mentioned before, sort of coming indoors is something that's very concerning, I think, to all of us, and how we go ahead and manage that. And certainly basketball and hockey are the two that I think will pose the biggest challenges. We also run swimming, which I know is happening right now in many facilities. Gymnastics, I think, is up and running in a lot of facilities, not high school ones, but youth sports. So, we're definitely concerned, I think, most about basketball and ice hockey right now.
So not being an ice hockey player, I'm a little naive, but growing up, I used to skate on like some of the local ponds and that sort of thing. And we'd, scrape it down and get it smooth and we could skate there. Is there any ability to do modified sports in a way that would bring them outdoors? I mean, whether it's for, I know indoor track typically is done indoors. And sorry if these questions are, completely bogus.
No, your questions are so good because Joe and I have been trying to think about where we could flood a spot for a hockey rink. So we're right there with you. We're just gonna do like they do the one time a year, the big outdoor winter thing. I think we should do it, but yeah.
Because there's like Mill Pond, there's Chauncey Lake. I mean, both of them tend to freeze at certain points. Obviously, you need people checking them and that sort of thing.
Okay, so I'm going to discourage this line of activity. Although I will say, I went to college in upstate New York, and hockey was very big, and I was in a fraternity, and in our yard, we basically had a hockey rink all year round because it was cold enough, and you basically just went out every night and put the water on light to get a fresh coat on. But yeah, we're not going over ponds, and then all of a sudden a mistake happens and kids are going through, and now we look really bad. But in any event, your point is well taken, though. Some of the hockey rinks do have almost like an open air aspect to them. I don't know. I've not been to the one in Westborough and to know what that facility is like. But to the extent that there's good ventilation, that would obviously help.
Sure. So the interesting part about hockey is so many states around us have been playing for so long. And we're just now starting to see those states sort of backtrack a little bit. I think they played all summer long, and now they're starting to see some outbreaks, and that's being caused by some of these hockey tournaments and hockey rinks up in New Hampshire, Vermont, Maine, all of those areas. So, that's gonna be something I think the state of Massachusetts is really looking at very closely before they decide to allow the state allows high school hockey to happen. The discussion I had with Amber today is I would love for us to find a way to engage these kids somehow. So even if it isn't full-on competition against other schools, would we allow our student athletes to still come in, would still rent ice, we would still have coaches in place, and to do skill development and training and conditioning and team building and some of those things that we're doing like right now in our football program, even though we can't compete in football games right now. So the state's been pretty clear about what we can and cannot do in terms of physical activity in those sports that they're still considering high risk. So for example, in hockey, there'd be no checking, there'd be no body contact.
Right.
But could they still be in a rink in a smaller number of kids skating and doing skill development? So that's sort of where I'm starting to lead down the path, especially in sports such as indoor track, like you mentioned. There's no indoor track facility in a high school in the state of Massachusetts that's going to allow all of these kids to descend upon their school and run a track meet. It's not going to be able to happen.
Right.
So how can we manage to run a program that's still viable for our kids that may not be competing against other schools, but can we still have them outside in our track facility outdoors? And can we do a little bit of training inside in smaller groups that still engages kids and has them stay involved with us?
Yeah, I mean, I know that the indoor track the track that we've been doing has tended to be like dual meets, I think. Yep. And then when we get into the winter season, it tends to be like 10 teams all coming together to meet. And I personally don't think that 10 teams coming together to meet is a good idea. I think that's just a recipe for, spreading disease. So yeah, finding ways to modify it so that, it might not look like a traditional, winter indoor track meet. It might be more of a dual meet type of situation, but I do realize that we just don't have the facilities to have really indoor, dual meets at all these locations.
Yeah.
Let me tell you what's on my mind the most when I look at the plans for winter athletics. And you talk about, for instance, in this page that we received titled Ranger Athletics, there's a point where the fourth bullet, the winter sports use a number of facilities that are not on our campus. And when I think about sort of high risk activities, what I worry about is buses and overcrowded buses, transporting kids from one place to another. And so, especially in the winter, the heat's on and the windows are up and this kind of thing. And so, one thing we haven't discussed is whether, there should be a lower limit of the number of kids on a bus at a time to allow for better social distancing, and whether that requires the use of some extra buses over what you normally would do in a non-COVID era. Is that something that you've discussed?
Yeah,
So we're actually, Oh, I'm sorry. In the fall, we've been operating under the same guidance that the schools have been operating. So a 71 passenger bus, the most students that we're allowed to put on it is 22. So we've really reduced the number of students on those buses with the windows down, every other seat, and sort of alternating.
Yeah.
What's interesting about all these facilities is these are facilities that it's expected that our kids get themselves to anyways.
Okay.
Pre-COVID or post-COVID. These are considered our practice facilities for the winter sports. And so traditionally our students have managed to get themselves there, usually through parents. Now, again, that could create a circumstance where you have to be careful that kids aren't getting in cars together the way that they used to pre-COVID. And we've had those conversations with them. But transportation for us has not been a huge issue. We've just doubled and tripled the numbers of buses that are carrying our kids to away games.
Okay.
I definitely think that in terms of the pieces that Johanna has presented, we're committed to the engagement, the exercise, the social emotional wellness, and the sense of competition that we can create. Training, practice within all of the guidelines of modification. As she said, like if we had parameters where they could do some hockey, it would be no checking, it would be practice sessions, it would be training, it would be drill engagement. I would love to see, one of the things that's incredibly good is our coaches working together are incredibly creative. I see them submitting some shared times for track, using ways that they can, personally set personal best records, do what they can. Like we really are engaged in bringing forward creative ideas that let them experience their sport if possible.
One of the sports that I didn't see is wrestling. Do we have a wrestling team, and is that just canceled, or we don't have one? Okay.
We don't have one.
Okay.
So organizationally, Dr. Ehrlich, we set this up so that if after you finish this range of conversation with Johanna and you feel that we can proceed within the guidelines allowable as outlined, but we keep checking procedure through you with Steve and sending back updates on implementation, I would return that. I put year before school committees tomorrow. They know I'm bringing back any modifications or additions to this memo. We can add more about buses or transportation or monitoring things, anything you feel you need from us.
Yeah, I think specifying what you're doing on buses is a good idea.
Okay.
I wanted to just ask, we haven't heard much from you, Dr. Hashmi, on this matter. Do you have any questions or comments you'd like to share?
None for me.
Okay. So overall,
Comment if I can, Alan.
yeah, sure. Let me just make a statement. So overall, I was generally satisfied. It looks like what you're doing seemed good to me. So, I'm comfortable with this more or less going to the school committee. Nathan, I'm sorry, go ahead.
Yeah, so the one question that I had was whether you had a sense for the people in town, the students in town, whether there really is going to be a lot of travel. I know that you kind of broke out in one of the paragraphs here about how you're going to have to work with people that need to quarantine when they come back, and whether you could logistically have tryouts or not have tryouts, and what was, all the different things that come in, and whether it would be fair or not fair. And I didn't know if you've gotten a sense from the community, whether it'd be worth getting a sense from the community, whether people are actually even going to travel. My personal sense, and obviously as an individual person, I'm not really planning on traveling, and I'm, so I wouldn't need to quarantine, but I don't know if that's just me or whether that's a larger community sense. I know with cases going up, I'm hoping that more people, would stay at home and not need to quarantine. But if it turned out that is the case where a lot of people aren't, I was wondering if then whether that would change any of your policies in terms of, when sports could start, or, other things about the schools.
That's a great question. I think I have the capability through our registration process to ask that question, or similar what I did in the fall was I did the registration process and then followed up with a survey asking if students would need transportation back to campus. So I do think it would be important to have families let us know one way or another if they are planning on traveling during those times, that could come back and affect us when we get back in terms of sports. So I like the timeline that we've set up. I like the fact that even though we're remote, we're not really hustling the kids back into activity too quickly. I like the slow rollout a little bit because in reality, if we are able to play games at all, it's probably going to be similar to the fall where we're playing 8 to 12 games, and we can get those done starting the end of December and running through February. And if we're not playing games, then to start too early in November would feel like a really long season with no competitions.
Right.
So I really had thought carefully and long and talked to a lot of people about that rollout of having sort of a week of open sessions and then waiting to do tryouts till we're all back. So that way, even if it's one kid that misses tryouts, that's too many in my eyes, because it puts that kid in a position where they have to kind of scramble to get back and caught up. So I like where we are with that, I think, in terms of that, but we will collect the data on who's quarantining or who's traveling during those times in terms of our athletes, without a doubt.
Good, thank you.
Yeah. I have one more question for you all, actually.
Sure.
I've sat on a whole bunch of boards and had some really good conversations. I think Dr. Lee Mancini from Shrewsbury talked with our athletic directors quite a bit when we started this. And there's been research out there that has been asking and talking about whether or not students that have contracted COVID and are coming back to us should require a physician's note to return to play. Similar to what we do with concussions, there's a thought process out there that students that have exhibited, pretty heavy symptoms or had some complications may want to do a graduated return to play protocols and have a note from their doctor that clears them to play. Now, the DPH hasn't put anything out yet. The MIA hasn't put anything out yet. They're just sort of guidelines and recommendations, but nobody's saying that you have to do this. So what I've done with our athletic trainer, Eric Stanford, is to ask him to have conversations with those students that have had positive tests to find out how severe their symptoms have been. And if they haven't been experiencing any real symptoms, we're allowing them back onto play without a doctor's note. Has anybody heard about any of that or have any thoughts on students that may need doctor's notes or return to play or the long-term effects of these student athletes?
So I don't have information to share with you tonight. I will tell you that in my day job, I work for a company that gathers medical information for clinicians to help with these things. And recently we got a request from a friend of mine who happens to be team physician for the New England Revolution, asking us to put together information for athletes following, COVID-19 athletes, how long they should be kept out and some of these issues. So within the next 2 weeks, I'll probably have a more complete answer that I could share with you at that time. But in the meantime, what I would tell you is, I think for the most part, if someone is not hospitalized, then probably a doctor's note wouldn't be necessary. I think that's a reasonable, objective criteria you could ask people. And if someone is hospitalized, then I think getting a clearance for when it's safe to return to activity makes sense.
Sure.
That's a good benchmark, actually. Yeah, thank you.
Yeah, it's an interesting conversation. I know it's constantly evolving and people don't know everything yet. And I know our inclination is to sort of jump on board and go to the extreme caution. So I just wanted to run it by you all. And if something comes up that you think that we should be doing, certainly to pass it along to me, and I can work with our nurses and our athletic trainer to make sure that we're doing everything we can to get these kids back safely.
Yeah. So like I said, within just probably 2 weeks or so, I should have a fairly comprehensive report sent to me, and I can share the key points with you at that time.
That'd be great. Thank you.
Question for you about information in that report. Would that obviously, if you're playing athletics at like the National Revolution level or professional sports, you may have access to like other sorts of medical treatment, whether they be steroid injections or other sorts of things. How much of it is translatable, do you think, to our student athletes?
Well, I will say the target athletic activity that we're looking at is college and professional. But I think there's a lot of overlap between college and high school. And again, we'll see the relevance, and I will actually talk to the team probably the next day or two to suggest that if there is specific information out there at the high school level, I don't think we have to worry about below high school. I think it's really high school that is the big issue. And at that level, I'll see what we can find out. And again, the team will be doing literature searches in PubMed and things like that. So.
Great.
And then finally, I think the only sort of thing that's hanging out there for both Superintendent Bach and I is the use of our facilities. And we've kept the school buildings, pretty quiet in terms of outside use. We're basically only using them right now for school-based opportunities. But our gyms, if any of you have had students that have gone through rec basketball and youth basketball and things like that, get very busy in the wintertime. We have not really made decisions yet on whether or not to grant permits and to start to have students in our gyms outside of school hours. So again, Amber, I might be jumping ahead here, Amber, and maybe you didn't know I was going to ask this question, but any thought on the rec department and youth basketball? They're all our Westborough residents. They're just not kids that may typically be in our buildings on a daily basis. So the younger kids coming to the high school for basketball practices and games and things like that. So again, this is all based on the fact whether or not Massachusetts allows basketball to really take place. But we're already getting a lot of requests for people to be in our gymnasiums.
So I guess my feeling is that if it's Westborough residents that only, then youth activities should be allowed to the extent that proper cleaning and whatnot takes place, and you don't feel like there's some carryover that would interfere with the primary goal of school, which is academic education.
Sure.
But to the extent that you feel like the conditions, and obviously, Steve can help consult if there are questions about policies and procedures to put in place. If the extra risk from Westborough students using it a little bit more probably isn't that great. Nathan, you have thoughts about that?
Yeah, so I think that you summed up the risk to the school pretty well. I think in terms of the risk of spreading disease, within the basketball rec group or within other groups that are using it, it's going to be a little bit different than having a paid coach there that is, let's say running the basketball program for the high school. Having the rec department do it, if it relies more on parent volunteers or other things to keep things going. And I don't know exactly how it works, but I know that that's in the youth soccer. A lot of the programs are relied on parent volunteers.
Sure.
Your ability to get compliance with all of the rules might not be quite as good. And that would make me be a little bit worried. I know that in the restaurant industry, we know that when the person in charge is very knowledgeable, the restaurants are very clean, well organized, they run really well. And when you have somebody that's not as knowledgeable, the cleaning goes way down. There's just a lot more inherent problems that exist. And so as you start to look at I'm a big proponent of the rec department. I think that kids need outlets. And so I want to find a way to make it work. But as you look at it, try to figure out how you need to get additional instruction or communication to those people that are running the program. If they're all Westborough paid employees and that sort of thing, then it's usually a lot easier. But as soon as you start relying on volunteers, it does become a little bit more challenging.
Sure.
Yeah, I definitely, I think we've had some preliminary conversations about this, and I've answered a couple emails from people. There's the travel basketball groups, and then there is the rec basketball. And when we all know one of the highlights of winter is the rec basketball and the competitions that exist for those. I guess my inclination is that, we're just the space renters. I'm not worried that it corrupts our space because our cleaning protocols are very strong. And after they leave, we'll utilize those on touch points and spray. What I'm worried about is if we don't get clearance to play basketball ourselves, why would we be opening the building for people to come in that go to school the next day and play basketball? So for me, that's the part of, I'm not comfortable with, and again, I can only speak about, this is a first pass on this conversation. I love these things. I would love them. Anybody listening to be like, oh, Bach just crushed basketball. I don't want anyone to believe that. I feel very strongly that please, all of these things need to proceed within guidelines. But I think that in terms of the travel basketball leagues, if I'm working and we're all working hard following all these protocols to keep students safe and distanced and not doing certain sports at school because it impacts our potential to spread disease, and then they all go out and violate social distancing guidelines playing rec basketball or travel league basketball or travel hockey when we can't play hockey. I just feel like it's a mixed signal to kids, and it's a risk that I would prefer not to have carry over into my school in terms of kids getting sick. So, I think that's where I feel like guidance from you guys would be, once the protocols for basketball are come through to Johanna and they get approved, if these groups can follow those same protocols, they can play within those guidelines, and we would rent them the space.
So I had, in my initial answer, presumed that if there's rec basketball going on, then it's because there's rules allowing school basketball to be going on.
Right.
So, if you don't have school basketball, I think it's perfectly reasonable to say basketball is not allowed. I do have a question, though. You said in the beginning, Johanna, about volleyball was allowed, but we're not doing it. Is that right?
Yeah, correct. So
Okay. So my question is, if you've heard, why does the state think that volleyball is okay and basketball isn't?
I think the nature of the two teams being on opposite sides of the court and not interacting very much. Also, there's
do
really
they
no
not go up at the net
contact.
against each other in
They
ways
They put a
you know what I
rule
mean?
in,
Like,
they couldn't do it.
what's
They
that?
did. They modified the sport so that you couldn't go up and block face to face.
I see.
So they did put a modification in there to keep that sort of face to face contact apart. So I think that they were thinking that volleyball is safer because the kids are not playing sort of that man to man in your face defense against other kids the way that you do in basketball. We've actually taken our volleyball program and we're just practicing right now, but we put them outside. So they set up outdoor courts on the softball field right now.
Okay.
I guess I would hope that we might wait for the staged, and I think I want to say when we met with Jen for rec, and she's directly coordinated with Steve, and we'll make sure that everything she opens up is absolutely within safe protocols. She's got a very tight program. I think it's just the travel basketball and some of the outside groups that are waiting for feedback from us around whether or not they'd be allowed to use space. So at the time I just said, well, we're going to wait until the protocols for sports come through. And when we see what's possible, then we would let them play within those same parameters, is how I left it. And I think in order I guess I would just keep you guys in the loop on that.
Yeah, I'm in favor of that as well, except for I would say that you want to make sure that the rec basketballs or the travel basketballs are having the same high standards that the, let's say, high school basketball has when it comes to making sure that like kids on the bench are spread out, or that, all the social distancing is happening. Right. I just don't want us to think that, because it's okay for the high school, that then you can do something in the rec that might not actually meet the same standards.
Right. And
I couldn't agree with you more, because all summer long when we opened up baseball and softball and soccer, I kept looking around and being like, this isn't going to fly at the high school level. And, the protocols that we put together as a league took everything one step further. At first masks weren't required on the athletes. And we're saying to ourselves, there's no way we're doing anything outside without a mask. They say that the mask can be dropped. Yeah, they say that the mask can be dropped at certain times. We're not allowing the kids to drop the mask. The mask is staying on throughout the whole game. They can take a little breather here and there, or come off the field and walk away from everyone and take a breather. So we've put in much higher standards than what I saw out of youth sports over the course of the summertime. And that's only going to have to increase as we enter the colder months and possibly inside.
Right. I do want to specify that it's important people understand there are differences there, because the recreation department, run as a facility through recreation, meets all those same standards. And certainly Jen's program, really modified and ran only what was possible within safety guidelines that Steve, they right across from each other. So like validated together. And I certainly think that the travel leagues, and I think even Jen knows that the rec leagues, it's not going to be so much fun if they can't play competitively, because that's, what we'd have to figure out. But I guess we just know preliminarily, the MIAA, the guidelines that are coming out will set the benchmark, and then those standards would be made available to anybody else who wants to try to play the sport. And if we have space available, we would, again, first priority is always we rent to rec and town facilities first, and then any other groups. So Jen is fabulous, and I have complete confidence that if those guidelines needed to be met, that they'll meet that standard working with us. And then I guess it would be coordinating with the travel groups, which I'm less knowledgeable of. So
Alan, I propose that Steve feedback to us as to whether we need another update in November at our November meeting. And if Steve doesn't feel like anything needs to change in terms of our involvement, that we let Steve and the school department handle it.
That sounds fine to me.
Yeah,
All
I'll
right,
just. Sorry,
Go ahead,
I
Steve.
haven't said too much. I just let you kind of do your thing. But I just want to say that John has worked well with it's been a pleasure dealing with her through all this. She's been spot on with everything. As Amber had said, Jen's right on the other side of the wall from me. She's in here all the time. We certainly are speaking all the time. So I think obviously Johanna's at the mercy of MIAA a little bit, and when we know what the requirements are, then we'll go forward with that.
Okay. But if you guys do want to get back into another meeting, Amber or Johanna, we will have another one in November.
Great.
Yeah, if possible, I was thinking that that if, again, appropriate to what you guys would want, that I might return and do a brief update on just our implementation of protocols, any adjustments we've made, release that pressure test, information to you so you can see the scalable size of rooms and things that we had talked about at the other meeting where we had visited. So that's certainly, all work that I'd like to discuss to see if I could get a brief visit with you to provide an update in November.
Okay.
Thank you very much. As always, it's very productive when we visit with you guys, and your support means a lot during this time. So thank you very much.
Thank you.
Okay.
We do for our kids.
Thanks. All right. Take care.
Take care.
All right. Next on the agenda is Mr. Kale. And I know we all had received materials. In terms of just introducing the subject, I don't know if Steve, you want to do it, or Syed, whether you would like to introduce Mr. Kale and set the stage for our discussion.
Yeah.
I can try it, or you want to do it, Syed? It's up to you.
Well, I just wanted to just give a brief introduction, if that's okay, Dr. Ehrlich.
Please.
So Mr. Kale is a high school senior, actually from Westborough, who's attending the Mass Academy of Math and Science at WPI. And he had reached out to me with some ideas, and I was just just thrilled that here's somebody that went out of his way to reach out, saw a problem, and wanted to offer some solutions, and has put a lot of work. He's got a YouTube video, he's got a presentation. So I'm just excited that he's involved, he's participating, and that's exactly what we want to encourage. And the fact that he's doing it at such a young age is, just I'm awed by that. So kudos for that. So, and yeah, Steve, if you want to take over, yes, please go right ahead.
Okay. Yeah. Well, you did a very good job there. Neil reached out with a paper on how to predict, a prediction model for how to dispense a vaccine based upon a bunch of factors. So I've shared that with you. I think I also shared the YouTube video that he had with you, and I'll just kind of turn it over to Neil to kind of, if you want to give a quick summary or kind of introduce what your findings were, that sort of thing.
Yeah, sure. So if you guys have seen the video, then I guess we could just get right into the discussion. But
So
if not,
excuse me. I did not get a chance to see the video. I did read your paper. So
Thank
if
you.
I've read the paper thoroughly, do I understand everything that's in the video, or is there more in the
Yes.
video that I?
Yes,
Okay.
the video is just a brief summary because I know you guys are
Fine.
busy right now. Yeah.
This might be referring back to this meeting, and so it's always nice to provide at least a short summary.
Okay,
Yep.
sure. So I think I can share screen. I prepared a few slides. And, Okay. Oh, guess we're starting at the end. Can you see that?
Yes.
Okay, so thank you, Dr. Hashmi, for the introduction. Yeah, my name's Neil. I used to attend Westborough High, and now I'm at the Mass Academy. And so what I wanted to do was develop a model that basically looked at not just factors like population or just, I guess, hearsay of saying, oh, this town's bigger, this town might have more cases right now because it had a big party last night or something like that, but a more robust model that would allow us to kind of say which towns should get more vaccines or will need more vaccines in the coming months. So right now we know the order of vaccination is going to be doctors and high-risk patients, then essential workers. But after we get through those, then who gets vaccinated next? How many vaccines do we give per town? It's sort of like one of those elementary school math problems, except now the solution could determine people's lives. So like I said, if we just go by the number of COVID-19 cases, then it's kind of an erratic, jumpy, it's a jumpy figure that just depends on, outbreaks, how many outbreaks have happened in a certain town, not really the possibility of another outbreak happening. And then if we go by population, then we can't distinguish between, say, Westborough and Grafton, who have pretty much the same population, under 1,000 people in difference, so other factors that are different. For example, Westborough has a much higher moving rate. People coming in and going out of the town might make more of a difference. So this is just an image of the application that I built. Basically, for each of the 351 towns, you can see all of the factors and sort of play with them graphically and by changing up the values to see what happens. So that's more of the academic side, a little machine learning on the back end. Let me make an optimal model that only looked at the statistically significant parameters. So just to kind of prove that the model works, the population only model is 70% accurate, whereas a full model, which looks at medical, social, economic factors, is 82% accurate. And since 50% is—
Can you just define accuracy? Well, what does accuracy mean?
Sure. So that means that on those 351 towns, the way I did it is I split any town that was below the median for Massachusetts on cases per 1,000, I said was low risk. And any town that was above the median was high risk. And so I looked at whether the model predicted high or low risk, whether it predicted a risk score of above 0.5 or below 0.5 to calculate the accuracy. Okay. So since 50% would be just like shooting in the dark, 82% is about 1.5 times better. So this is the risk map that I made. You can see that towns like Worcester, Springfield, Boston, the big ones, are obviously the highest risk because they have the biggest population, the highest susceptible minorities, and social inequality. All of that sort of plays into it. When we look at like the local towns, Shrewsbury's at the top with a 0.95 risk, and it scales from 0 to 1 on average. Well, except for like the really big towns or really small ones. Westborough's at 0.9, Northborough's at 0.73, and then so on down. So just briefly, some of the future plans I have. I want to see if we can put this into usage. Well, I guess that's the question that I have for you, whether this is actually useful in any way or how it might be made useful to help you guys, well, I guess when you're going around now in the next coming months trying to get vaccines for the town, to maybe support your case with hard numbers, whether that's something that'll be helpful or whether there's something else I can add to this to make it more helpful. And also, if any of you are interested in testing the model or maybe looking at the data itself, all of that's available on my blog, which I put a link here. So besides that, I want to improve the model. And one way that I think that we could do that is looking at more granular data, so neighborhood by neighborhood, if that's available. Since I was just working with what's available online, my data is also from the 2010 census. So if there are more recent numbers, which maybe aren't available publicly online, those would also be really helpful. So just one last, I guess, surprise. I've made the model in a way such that it can not just look at a certain set of factors in a certain set of towns, but any like grouping of communities and based on any factors. So this model in front of you right now just looks at the population and the political demographics for communities across the country, counties across the country. And it was about 77% accurate based on those values. So that's basically where I'm at right now. Any questions or comments? I'd love to hear it.
So I've got some. I don't know, Alan, if you want to go first, though.
I'm going to let you go first, Nathan. Go ahead.
Okay. So I had a series of questions. I sent some to you by email, and you answered most of those pretty well. But I do want to kind of emphasize that the early stages of a vaccine, especially one that whose safety or efficacy at this point hasn't been demonstrated yet because it is still going through trials. If it turns out that a vaccine were to be announced as ready and we target specific groups of people, and if that targeting were to, let's say, be inner cities or places that might be at higher risk of, getting COVID-19, I think right now there might be a increase in Black and brown people that are getting COVID-19. And if we were to target a vaccine directly to those people, and it turns out that there was something wrong with the vaccine, it could come across very poorly. It would be almost like we were testing it on those people as opposed to trying to help them. And so I want to make sure that we, obviously if the vaccine were to be safe and efficacious, then I think it makes sense, and your model makes a lot of sense to try to figure out how do we best deploy a limited resource. But living in the real world with extra complications, I just get a little bit nervous about endorsing a plan while the vaccine is actually still, I haven't seen the safety data yet. So that's one of the issues that I had. Another one of the issues that I had was areas that, or groups of people that sacrifice a lot, put on masks, don't go out and socialize, and really are taking the burden of kind of protecting themselves and their community. If you use the model, you might decide that those people don't need the vaccine. And what you would end up doing is supporting bad behavior, in that those people that are going out without masks and partying, you would then say, oh, you guys need the vaccination the most, so we're going to give it to you so that you can keep going out without your masks and partying, while everyone else who's been sacrificing is forced to sacrifice for longer. And so I want you to just be aware that there's some of that sentiment that also makes me nervous about kind of rewarding bad behavior by focusing on those places where people are making conscious decisions. It's very different, and I know, Alan, you're probably going to jump in. There's a lot of stuff that goes into this that is not a conscious decision where people are doing things on purpose. I mean, some people are living in crowded dwellings and they don't have any control over that. But yeah, I'll let you jump in, Alan. I can come back.
All right. So I'll start by rephrasing that last bit that Nathan put forward, which is the same thing, though. A question I had, which has to do with, how robust is this modeling over time? Because in essence, when you are saying these groups have had more cases in the past, well, at some level, those communities are at less risk because more people have already been infected. And for the most part, while there may be some examples of people getting infected more than once, we certainly think that's the minority of cases. And so the at-risk populations may be precisely where you don't have high case counts currently. And I think that's what we've seen around the country. Initially, most of the cases were in Massachusetts, New York, New Jersey, Connecticut, places like that. Those places have now subsided, and we have California and Florida and Texas, which had low case counts initially, with rising case counts now. So case counts tell you what's happened in the past, but they don't tell you what's going to happen in the future. So that's one issue I have. I have some particulars about your methodology, but I want to get at the other high-level issue, which is, as a doctor, I don't think in terms of what towns should be given the immunization. It's what people should be given it. And so, for instance, you obviously mentioned healthcare workers and essential workers, but if I had to immunize another group as the highest priority, it would be, elderly, people with chronic diseases such as diabetes that put them increased risk for complications. Because what's clear is that not everybody gets COVID-19 has the same effect. The vast majority of people have a mild disease and get better and have, and that's the end of it. but we do know that some people with certain risk factors are at particularly increased risk of hospitalization or death. And so, the idea of trying to build a model that looks at what communities will get, should be prioritized, I'm not sure makes sense from a public health perspective. I have questions about your methods, but I'm going to pause there. You've heard a bunch of stuff from Nathan and myself, and give you a chance to respond.
Sure. All right. So first, thank you. I appreciate it. I guess starting with the idea that groups who sacrifice a lot might be at a disadvantage because of the model. I think, yeah, that's a good point. I didn't actually think of that. But I think that the people, like in general, I wouldn't say this without data backing it up, but it's also quite possible that a lot of those people don't have the option to, I guess, stay at home or to stay in a safe environment. For example, I think Dr. Walsh took the example of people who are living in the inner city. Well, obviously, you don't have a lot of room to socially distance there. People who are going to work because they don't have a choice about that. The idea about elderly and chronic, or people with chronic diseases and people who are elderly, I think that would sort of fall into the group of people who would be vaccinated before this model even comes into place. I'm thinking more about people who are health-wise very similar. The vast majority of us who are, I'd say, below 65 without any pre-comorbid conditions, anything of that sort. I guess determining within that group how to just separate out the vaccines, how to give them or how to distribute them might be a geographic task just because, well, if there was a clinic in Westborough and it was, and a clinic, say, on the other side of Worcester, then deciding where we put that clinic might also decide or might have an impact on how many people are going to go there from like the surrounding communities. So if we put a clinic over in Worcester, then we're targeting at people who are living in more close conditions, people who might be more likely to be part of a minority group, and so forth, without specifically saying you can only come and take this vaccine if you are Black or if you are brown. I think we mentioned that those groups are also showing higher numbers of COVID cases. So while we can't directly say that, we can put the vaccine clinics in a place where it becomes more accessible to those people who might be at a higher risk. Yeah, so.
I have a question for you, Alan, because I was talking with a doctor today, and he was describing the situation back when H1N1 was around and we had limited vaccines. And he was saying that people were approaching him or calling up the office and actually offering cash in order to try to get a vaccine that was like specifically supposed to be targeting one group of people, like the elderly. And, obviously he was, aghast that sort of thing was, happening. And I'm wondering what your thoughts are, if it turns out that the first batch of vaccine is in high demand and obviously the demand is higher than the supply, is this something where we would actually be better trying to do it more like we do a flu clinic in Westborough, where instead of it going to the doctors, it just goes to the town, and that the town, does a mass vaccination clinic? Or what are your thoughts on the best way to handle some of those?
This comes up in medicine periodically, where there's some shortage of a resource and demand exceeds the supply. You could look at organ donation. Back in the day, you could talk about kidney dialysis machines or things like that. And the general approach that we take is that whether it be the FDA or the CDC or the NIH, but some governmental authority at a national level puts in place rules, and those rules will prioritize. And if that doesn't adequately determine who gets what, then there are waiting lists, such as for organ donation or things like that. So, again, that kind of thing's going to happen. In our case, at the very least, it's at the state level. The state's going to say, this is who gets it and who doesn't. And we're going to be tasked with implementing, but not making those decisions ourselves. Steve, I don't know if you want to comment on that, but I think that's a reasonable representation of what's likely to happen.
Yeah, I mean, I was here in 2009 with H1N1, and I had people calling me, asking me who they should sue when they can't get the vaccine. So things happen. But, as far as I can recollect what happened then, we got the vaccine. We were told who could get it. We held big mass vaccination clinics. And so that's how it was done then. Now, that being said, back then we were doing big flu clinics from a Board of Health perspective for the seniors, and every Board of Health was doing huge flu clinics. Things have changed as far as the state model. Now that CVS, Walgreens, those facilities can give the vaccines out, a lot of our flu clinics have diminished quite a bit. And this was not the instance in 2009. So there is much more, at least from my opinion, a capacity there for private, vendors like CVS and those to give out the vaccine too. I don't know how the distribution will happen. Maybe they're the ones that go through. Maybe us. Probably a combination. This is all me guessing, but things are certainly different now than they were in 2009 when we were distributing the H1N1 vaccine.
Okay.
Dr. Early? Dr. Early?
You go ahead. Say it, please.
I just had a couple of comments, or do you want me to wait till the end? What would you like?
Well, I want to try and bring this to a close. I know Mr. Kale's original aim was to see how this might inform decision making and getting some feedback, at least from us as a semi-informed body, to give him some feedback. And so I want to try and after we've obviously discussed elements of what's gone on here, and we can have a little bit more discussion of that. But then let's try and bring it back to the reason he's before us tonight.
No, I just wanted to the comment that I wanted to make is, I think, my interest in his presentation was actually not about the vaccine, because to me, the vaccine is still a ways away, and as Dr. Walsh pointed out, there's still safety that it needs to go through. But what interested me about his presentation, and this is what I really want to commend you for, Mr. Kale, is the fact that you actually looked at the social and demographic data, which is something that, all too often I don't think that we look at too well. And I think, looking at that data and showing that they are exceeding their huge disparities in a quote unquote state as wealthy as Massachusetts, that then leads to discrepancies in survival, in access to care. All those other things feed off this data. So while you were looking at, using this tool as a vaccine, to me, the real advantage of this tool is for you, to start to understand that this is how all the things that we see in clinical practice come from. These discrepancies start here. This is the root cause of some of those problems, intractable problems that so many of us see. So, I think this is a great first step. I think that's one thing I wanted to say. The second, you asked about. You're right. The census data is old, but there are, and now I'm blanking on them, but there are. You might get more information, and Steve, maybe you can connect. I don't know who. Isn't there something like with mass housing or something like there's the Massachusetts State House or state government has vital statistics, right, that are much more up to date. Am I getting this correct? Do you know anything about this?
Honestly, no, but we can look into it.
Okay, all right. So just that. So just points. I think this is. I think this is just a really impressive, well done job. Thank you. That's all I had.
Thank you, Dr. Oshman. Alan was saying, to kind of get back to how we can kind of give you feedback, I think that recognizing that we are a town and that we're a board at least that supports a town, we do have limited discretion in how we can control the distribution of a vaccine. And if we were given an allotment for whatever reason and we had to decide how to distribute it, I think, Alan, you framed it pretty well, that we would be looking at those individuals that might need it more than other individuals, based on risk profiles and that sort of thing. And so I think that what you're probably going to be more interested in is targeting at the state level, which is how does a state get to decide where the vaccines actually get distributed to. And one of the things that I would like to say is that there are, similar to like the National Guard, there's a medical reserve corps, and that they practice doing mass vaccination clinics and dealing with, health disasters and that sort of thing. And the Mass Emergency Management Association, MEMA, uses those groups when it comes to try to do some of these things. And so when you said, would the distribution site be in Worcester? Would it be in Westborough? Where would it be? There are groups that have trained for this, and they would probably help take part in some of these activities. And so some of this stuff that you're thinking about, when you come to the logistics of it, one level is the high level, like who should get it, but then how do you get it there? There are groups in place in Massachusetts that are responsible for helping with that distribution. So I'd say that for some of the stuff you're looking at, I think it's has some great ideas in there. I do think that some of this might be more targeted at the state level than the town level, though.
Thank you, Dr. Walsh.
Okay, I don't really want to take more time now. If you have questions, that'd be great. I'd be happy to have myself or any others answer them. But I think we appreciate you coming before us and sharing your work with us. And I hope we have been helpful in giving you some feedback about ideas or pertinent to your work.
Yes, thank you very much. I don't have any experience in public health myself, of course, so it's really nice to hear from people who do and see your take on things.
Great. Well, thank you very much.
Thank you.
Okay, we're next going to be discussing Halloween and whether we as a board wish to make any advice or recommendations to the town regarding the practice of Halloween this year. So, Steve, you just unmuted. Why don't you take it from there? Sure.
So, the state has put out guidelines as far as Halloween. It's on their website as far as tips for a safe and healthy Halloween. For the most part, it talks about keeping, functions outdoors, maybe people placing candy outside their house, individually packaged bags, maybe having hand sanitizer available, that sort of thing, as far as what they're recommending this year. I think some towns have gone, at least I know one in particular, have gone and they've canceled Halloween. I don't know how many of them there are, but I just felt that the board should have a discussion. We are getting calls here in the office wondering if we're going to be doing anything. I think I forwarded you. I think we got 4 emails, maybe last night and today, about people who were concerned. I also, Dr. Hashmi just forwarded an email for someone who was in favor of having Halloween. And I did get a phone call today from one resident expressing her support of having Halloween. So, I just felt that it was something that the board would, the community is wondering what the thoughts are from the board. And, here we are.
Okay. Does anyone else wish to make any general comments before we get into the discussion?
I always have lots of comments, but I'll wait for the general discussion.
Okay. So I do think it's worth starting before we begin our discussion with a brief summary of the feedback that we did receive. I know you addressed it. You mentioned that at a high level, Steve, but I like summarizing the various emails that have come in. And I'm just going to pull them up so that we can reference them appropriately. So
Dr.
we received, hello?
Yeah, Dr.
Yes.
I could tell you, did you get the one that I just forwarded to the board?
I believe I did.
Okay.
And I will mention that specifically, Syed.
Okay.
So we had, this is in no particular order. This is from one resident who, loves Halloween, thinks it's a great thing, has concerns about the downtown neighborhoods being inundated with kids from all over town, and that in those situations, even though you can encourage social distancing, it's a very social holiday, and young kids often don't remember rules and whatnot. So that was one person. There was another one who voiced a concern that we don't need large crowds forming tonight, and that there's concern because the case rate for COVID-19 is rising in the Commonwealth. There was one particularly centered around the West Street area in town, and again, an area where large numbers of kids come through. Concern again that large dense populations congregating at a time when COVID is rising, so that concern that maybe this might lead to some super spreading event of the virus, and that would outweigh any enjoyment. I think there's one more on the negative, just a person calling in saying, hey, I think you should cancel it for the health and safety of all. On the other hand, we did receive one which basically says there are large portions of town where the number of kids coming through is not large. It's very easy to socially distance. It's unfair to those families who want to enjoy the holiday safely to not have it because there are benefits from these types of social interactions. So I think that summarizes most of the correspondence we received. If I've left anything out, Steve, please let me know. But what's that?
I know, I think you did a good job summarizing.
Yeah, I just like that all to be entered for the record, so that people know their voices were heard and that their comments are part of the discussion, especially as we are not able to have people in person stand up and give us immediate feedback. So with that said, Nathan, please share your thoughts.
So similar to many of the residents, I can kind of see both sides. Shutting down all of Halloween for everybody is something that is things that we have done back when there were, blizzards and power outages and like safety issues where we thought that people would be at high risk of getting, hurt. So obviously, a pandemic situation is similar and different in many ways. But it's asking us the question as to the Board of Health. Can it be done at all safely? Do we have to cancel it for the whole town? And my feeling at first is that, I think that there are probably some neighbors that may want to trick or treat at each other's houses because they've got small kids and they know their neighbors and they may be hanging out with them anyway. And so to put like a curfew in place or something like that, my feeling is that that's way too far and way too strong. But I am concerned about having a throng of 30 kids all tightly packed running from, one house to the other, crowding onto a single porch to, try to collect candy. Also seems like a very bad idea. And so how do we, walk this tightrope? And I'm interested to hear what other people on the board have to say.
So I guess my starting point is always to think about, we're responsible for Westborough, and Westborough is part of the whole Commonwealth. And so as we hear about what's going on within the Commonwealth, we know cases are rising. I think it's worthwhile, first of all, starting with, how are we doing in town? And in general, our case counts are, they're persistent. They're low but persistent. And I think in Steve's last report, we had 15 new cases in town. The week before that, we had 11. So within the town of Westborough, we are, I think, are we still color-coded as yellow?
We are right now, yes. Just to give you an update, so far this week, we have 5. So, we're trending lower this week. That could change tomorrow, of course.
Of course. But, I do think overall, if you look over the last, 6 weeks or so, our numbers are relatively stable. And so I think the town is doing well. Now, whether that implies, okay, so we shouldn't be as concerned as some people are suggesting, or whether it implies, so let's not screw it up, okay, because we're doing well. I mean, you can take it from either perspective. Both are equally valid. I think that if you look at some of the guidance from the state, I do think it will mitigate some of the concerns that have been raised. Certainly the idea, they say on these instructions, put candy on a platter instead of a bowl. So lay it out, and then you can, what I would do in my area is just put it on my front step. I can have the storm door open so I can see people come and go and know when to refill the platter, but you don't have to, physically hand the candy into the kids' bags the way we might have done in the past or whatnot. So I think that there are prudent things you can do if you wish to do this. The question is to whether, the board should be making a townwide decision about this. I'm reluctant to go there. I prefer to give advice as to what people should and should not do. I realize that based on the feedback we have, the situation is different in different parts of town, and maybe what's appropriate for some of the developments on the outskirts, whether it be out near Almond Farms or up near where I live off of Ruggles, where the houses are widely spaced, and if the kids are going around, they aren't in packs of 30. That may be very different than the downtown situation. So I think whatever we do, we need to issue clear guidance. And I think, everyone, even if we make no recommendation one way or the other about whether you should or shouldn't trick or treat, everyone needs to take their own circumstances into consideration. If you don't want people coming to your house, have the light off, and if the light's off, don't go to those houses. And if you are out and about, you clearly need to maintain social distancing. And even because you're going from house to house, wearing masks, not just of the costume kind, but of the kind to protect you from COVID would be appropriate.
I had a question for you, Alan or Syed, if you could answer this, and that's that obviously there's two types of transmission that we worry about. One is from the person in the house giving out candy to the kids, and then the other is of the kind of the kids giving it to the person in the house. And they're very different routes. And I was thinking about that a little bit, and I was thinking that if somebody was, let's say, sick and didn't know it, and they were giving out candy, that they could potentially have contaminated all of their candy that they're giving out in terms of the wrappers. And the kids that then would go to eat them might be unwrapping them and popping them right into their mouth, and having just touched the wrapper. And so I would think that the risk would be higher in that direction than it might be in the other direction where, kids might just be reaching into a bowl to grab some candy. And, I just wanted your thoughts on, where the major risk points are.
Say, do you want to comment? Or do you want me to?
Do you mind if I just give some general comments?
Yeah, please go ahead.
So I'm exceedingly worried about Halloween this year. I'm at a place where, I get to have friends that are taking care of patients with COVID. The case counts are going up, and I am just I'm deeply concerned about having a gathering like this. And I think what Dr. Walsh brings up are all those issues. I don't have if there are people that you've been socializing with or whatever in your pod, I don't have a problem with that. But one thing I will say is I actually looked at the guidance, the guidance that Steve had sent from. Was it from the state, right, Steve?
Yeah.
You copied us guidance from the state? It's 2 pages.
Correct.
It was 2 pages long. I'm just trying to figure out, like, if I, with everything that I've got going on, have difficulty following these guidelines. I'm thinking, well, how are parents supposed to, like, with kids, work, all these other things, supposed to follow these guidelines? And I think that makes it even much more incumbent on us as a board that is responsible for the health of this town to issue clear guidance, no more than 3 or 4 lines that parents or the schools can then disseminate. And I think paramount in all of these discussions, and both of you have alluded to this, is to ensure, that our case counts don't go up. And that is why I am truly concerned about having, large scale gatherings, I guess, for want of a
So-
better word. And I trust me, I do not want to be the Grinch that stole Halloween. Okay, I do not want to do that. But on
So,
the other, go ahead.
Syed, directly to your point, this is this 2-page thing from the state is about Halloween activities in general. And if you want to talk about giving advice, and I think we should, for trick or treating, that is 3 or 4 lines. For instance, on page 2, they talk about things like avoiding crowded costume parties held indoors. Avoid going to an indoor haunted house where people may be crowded together and screaming. Okay, that seems like great advice to avoid. Okay, going on hay rides. These are not trick or treating events, though. That's my point. And so, what do they say? They give advice to both the people who would give out candy and advice to those trying to collect candy. And, obviously, the first piece of advice is enjoy Halloween outside. Trick or treating is outside. Place the candy on a platter instead of a bowl. We talked about that. We talked about the notion that you need to potentially put out hand sanitizer or wear a mask. That you have to wear a mask in addition to the costume mask.
Right, Dr. Ehrlich, this presupposes several things. One, that you have access to these guidelines, that you have knowledge of these guidelines, that you can afford to buy hand sanitizer, and so on and so forth. I mean, these are,
So let me take those one at a time. Part of our job is to decide what information we're going to put forward to help people understand. Again, if you don't, let's say you can't afford hand sanitizer. I mean, you don't have to give out candy. You can just have your lights out and be dark. And many people do, whether they're away or they choose not to participate in trick or treating. And I think that's that. What I will say, what's that?
Soap and water is even more effective than hand sanitizer. So on the people that are giving out candy, washing your hands with soap and water might actually be preferable to hand sanitizer.
I absolutely agree. But those are the that's the advice around trick or treating, and everything else is really around other activities or maintaining social distancing that we're recommending in the first place. So I think the number of pieces of advice around that is limited. I think the question that you asked, Nathan, about which way is the risk greater, I agree that the risk is greater from the household to the trick-or-treater, especially if I'm just putting candy out on a platter on my front step and I'm not doing anything else. The risk to me is essentially zero. The risk to the children is relatively low. Children, again, generally, even if they get COVID, do well. And they're not eating the wrappers, so they're just sort of touching the wrappers of the candy. And clearly, we know that the severity of the disease has some relationship to the amount of virus that you're infected with. And the amount of virus you're likely to be affected with by somebody, if somebody's not coughing or sneezing over the candy, they're just touching it, especially if they do what you say, which is to wash their hands, before they set out the candy. While there may be some theoretical risk, on a practical level, if you take these steps, the risk should be very small. The flip side is, okay, what are the benefits of trick-or-treating to the children, besides the fact that they get, to go to the dentist and things like that? Okay. You have to say during these times, what is the importance of social activities, of trying to maintain some sense of normalcy in very abnormal times? These have psychological benefits, and what is the value of that compared to the risk? I think that varies quite a bit household to household.
Yeah, and on that line, and also in line with what Syed was saying, not everyone has a copy of these guidelines from the state. There are a few things that I think maybe touch on both of those that the state provided. And these are other activities that you could do to maintain some of that social aspect of it that might not necessarily be trick-or-treating. And things like decorating your yard for others to enjoy when they walk by or from their car. Holding virtual costume contests or pumpkin carving events, both can be done, very safely. celebrating with members of your household with a Halloween-themed meal or a Halloween movie night, or by prepping a Halloween scavenger hunt. There are activities that might be able to be done that could still bring together that social aspect of it without actually physically bringing people within 6 feet.
Okay. Do we have any other, aspects of this that anybody wants to bring up before we get into a discussion as to what, if any, recommendations we're going to make as a collective board? Okay. So I think we have three options, we have a couple of options. One option is we can make a recommendation one way or the other about whether trick or treating should be advised against. I'm not sure. I mean, I suppose we theoretically could ban it, but I'd prefer that coming from the Board of Selectmen if that really were to take place. I think the other thing is, we can make advice as to how to do this safely. I think those are probably the two options we have. So we have three options. Three. We could refer this to the selectmen.
There's Nathan.
We could ban this, or we could just make recommendations on what we think is a safe approach for those who choose to want to participate, and obviously recommending people not choose to participate if they have concerns. Go ahead, Syed.
No, I think Nathan's path, or Nathan's thing is worth discussing. I mean, in the options, right? If there are people that want to do this, I think we need let me just try to see if I can get my thoughts together. I think we should, as a board, encourage the non-trick-or-treating activities, as Nathan has alluded to. Okay, that there are other options other than trick or treating, and that are worth considering, and those should be the priority. And if we choose to do this, I think we need to somehow control, sorry, I'll just stop. Let me think some more. Go ahead.
Let me jump in. The CDC has come out with some statements, and they basically defined the aspect of going around and trick-or-treating as a high-risk activity. And what they were recommending is that we try to substitute high-risk activities for lower-risk activities. There are things that are worse than trick-or-treating, though. And those are things like having a crowded party inside somebody's house. That is worse. So I want to be clear that whatever decision we come up with or recommendation that we make, that we're steering people toward lower risk activities rather than higher risk activities.
And that's sorry, Nathan, you hit it right on the head. And I think that's where we need, that's where we get the two strands together. I think that is why we should, I think as a board, take a stand against trick-or-treating, but say, hey, look, you can virtually, you can put stuff in your yard or something. And I think that's the key, I think that is the key message, the key message that we need, public health message that we need to get out in these times, because again, the rates of COVID are rising there. And so we need to be, we need to protect our residents. I think you hit it. I think I'm with Nathan on this. If we can combine the two, hey, we don't recommend trick or treating, but here's, these are the activities we do recommend.
So I will only say that decorating your yard for others to enjoy is something that adults will find fun. And if you're a child and you could say, no trick or treating, but we're going to get to decorate the yard, okay.
Hey man, you haven't seen the yards yet. They're really cool yards. I mean, you got to have a heart of a child, Dr. Ehrlich. Come on, move with the time.
I do know a neighbor's yard was recently decorated with 40 pink flamingos, and I'm sure the children had a lot of fun with that. Okay, but
come on, yes, there's some great decorations in town. You open your mind, travel around, walk around. Yes, there's cool things.
So I'm not sure if you go as far as Syed in terms of wanting to either outright ban or to tell people that they should not do it at all. I think that I'm somewhere around the place of wanting that if people are going to go out trick or treating, that they really keep their group size to just a their own family or their own cohort. That the groups.
Could you stop for a second, Nathan? 1 second, because I think these are points that we all agree with, and I would like to have specific points of advice
Which
that we're
points
going
do we
to
agree
give.
with? Which points do we agree with?
Number one is that if you do go trick or treating, just your own household. Don't go with other households. That I would
But-
make that point one. If you keep going, Nathan, I think there may be some advice we give, short of banning, but for those who choose to do that. Could you
We should-
continue?
Hold on. Are we still going with the trick or treating is going to be okay? Are we?
No, we're
gonna
not saying
clarify
it's
that?
okay or not okay at the moment. But I think what he's saying is, if you do go trick or treating, in other words, Syed, are you going to make a motion that we forbid trick or treating in town?
No, but I would strongly urge us to make sure that people realize that it's a high risk activity.
Okay, so let's say we do that. Let's say we urge people not to go trick or treating,
Make that
but
point.
go ahead, Nathan.
I was going to say, yeah, I think that Syed should be point number one. It is a high risk activity.
Right.
Okay.
And I think that is a message that we as a board need to communicate to the residents of the town that this is a high risk activity. I think that's the message, that the public health message that we need. Go ahead.
I would suggest modifying that first statement, okay? Because I'm not convinced that it necessarily is, but I'm fairly good about saying the CDC has indicated they consider, the CDC considers trick or treating a high risk activity. That's a statement of fact.
Yes, I'll go with that.
And then the second one was if people are going trick or treating, that they should go with their household unit
Yes.
Only.
Only. Agree.
I mean, I think maybe there's some exception where if you are the only child in a household or the only child that's going out trick or treating, that maybe it would be better to have somebody that can do a lot of things to go as they pair, just in terms of safety.
In terms of safety, I'll just tell you that in most places, parents are not too far. They're parents who are circulating, making sure there's no trouble for the most part.
That's fine.
Okay.
Then.
So that's point. So we've got point one, we've got point two. Then the third point is what Nathan has alluded to, right? That there are other activities that. Sorry, go ahead.
I do think we need to suggest the other points about safe trick or treating include wearing a mask in addition to whatever costume mask you have.
Yes.
A mask that's capable of filtering. Yes.
Yeah.
Yes.
Steve, you want to chime in?
Yeah, what I would suggest is I could take the DPH's recommendations about, placing candy on a platter, where is it here? Hand sanitizer, mask use, all that stuff, social distancing, and put those as bullets afterwards.
I think that's fine. And then a third major point is alternative activities that would, instead of trick or treating.
And I think that is, can we at least agree that as a board that we would encourage you to pursue other alternative activities other than trick and treating, such as, the examples of, can we agree on that we encourage these other activities over trick and treating?
I would encourage some of these other activities over trick or treating. I'd go that far.
Okay, so that's what you want on. Also, after the bullets, as far as how to reduce risk if you do go trick or treating, then that the board encourages.
I'm not sure I'm totally on board with encouraging this, but what I'm okay with is simply saying alternatives to trick or treating that the board feels are lower risk include.
Okay.
And then we can outline them.
Right. And so Steve,
the state is fine.
We're getting some feedback here. Shelby is weighing in. Shelby Marshall, I believe, is chair of the Board of Selectmen. Is that correct?
Yes, and she's been trying to reach me. We've been playing phone tag for like a week now, and so I haven't been able to hear what the selectmen are up to.
Well, it's at least her in the chat saying, if we say it's a high-risk activity, that means nothing to the average person in town, and they're going to just sort of do whatever, I assume is the implication of that. I'm just trying to pull up the chat. And of course, I'm having a little trouble. I can't, let me see, maybe it came as an email. Let me just double check. Yes, I do have it as an email. I'm sorry. So this is from Shelby Marshall to me. Actually, everybody else, Steve, Nathan, Sayed, you're all on this. Making this a high-risk activity will not mean anything to the public. Sorry, guys. So that's feedback from our Shelby.
Yeah. So, I mean, I think in terms of other guidance that we could give to even if you were going out trick or treating, we mentioned trick or treating just with your household, but only going to houses that you regularly interact with might also be another way to do this as well.
I think, yeah, saying limiting the number of houses and going to just within your own neighborhood. We don't want people flocking to the downtown area.
While I got you here, I got an email from a resident that had previously commented. He says he feels that the board doesn't understand how big and dense the crowds get in the middle of town. So anyways, just throwing that out there. So you came just to me. I can forward it to all you also. But
yeah, I mean, I don't have a sense as to how big the crowds get downtown. I do not want to see big crowds downtown. I do not want to see big crowds even in neighborhoods. I think that big crowds are a problem and present a big risk. So,
but then we're not doing anything to address that, right? I mean, that's my concern, Nathan.
Crowds.
I'm sorry, Nathan, you were breaking up. Say again.
I was saying that we are telling people not to go out in big crowds.
So the question is there anything we can do? We can give guidance, and if, let's say, people ignore our guidance, okay? Well, what are alternatives besides guidance? Is there anything in between guidance and passing some edict saying it's forbidden? And if there's nothing in between, then we're sort of between what I think is a no-win situation.
I guess there could be, curfews. There could be gathering requirements. I mean,
that's
these are things
a bridge I'm not ready to cross. Even I'm not ready to get that.
I'm not proposing that we do these. I'm trying to respond to your legitimate question of what other tools do we have in the toolbox, not whether we want to use them.
Yeah, but I mean, the alternative is, I mean, look. Let's just focus on the basic fact. We all three of us, the CDC, which is the public, kind of the apex public health body of the country, is saying trick-or-treating is a high-risk activity. Okay, we're a town that is in yellow. Why don't we just flat out say, look, this is something that that we either ban or do not recommend.
Can I say something?
Yeah, please.
So my understanding is the town does not set hours for trick-or-treating, does not even it's not a town-run event, okay? And Sad, I think you've had conversations about this as a selectman. So even if we were to outright ban it, it's not a town event.
Oh, right.
Okay, yeah. So, I mean, I think we would need to have a joint ban, not only the Board of Health, but the Board of Selectmen and everyone involved, because it's not a town event. We don't set hours. This is my understanding. Please correct me if I'm wrong, Syed. So for us to ban it, I don't know what teeth we really have.
No, we'd have curfew, and that's why I was bringing that up. I mean, we could say that nobody's allowed on the street during certain hours. Right. That would effectively ban it, but I don't think practical, and it would prohibit other legitimate aspects of people's lives that might not be appropriate.
So I think we're back to issuing guidance. And again, we did get, I saw the email, Steve, that you circulated from gentlemen pertaining to West Street again. And, I'm sympathetic to the people downtown where they appear to be shouldering the burden of both high volume and also the dense packing of the kids. What might be appropriate, I don't know what we can do other than, well, I think we just have to issue the guidance and try and promote it as much as possible. Maybe on the signs that the town has that, give messages like at the corner of Lyman Street, something reinforcing the importance of social distancing while trick-or-treating or something like that. If you go trick-or-treating, remember to maintain social distancing,
And
you know,
Steve,
that kind of thing. I think we just need to try and educate as much as we can, because I don't know what else we can do.
So
and Steve, sorry, can we disseminate this stuff to the, I mean, whatever we come up with, can that be disseminated to the schools to send out via their
Sure.
communication to the, sorry?
What I'll do is I'll put together something tomorrow, by tomorrow morning, and send it out to you guys just for final review. And then I can shoot it out on our stuff. We can shoot it out on the Facebook page, and I can shoot it. I'm sure Amber can help me disseminate it to the school.
Yeah, I think it's the most important thing is the emphasis on people not going to the downtown area, people who don't live there. You want people who are up, on the more peripheral parts of town to just stay in their own neighborhoods.
So I've got a question for the downtown neighborhood and why people are gathering. Is this because they're getting candy in the downtown area, or are they gathering just because they like to be in a large crowd and they want to, almost like not a protest, but some sort of group where they just kind of all get together and hang out? And I'm just, does anyone have any insight into the crowds downtown? Because if it's a matter of just about food, I mean, the best way to keep animals off your property is to not put food out.
Can I make a comment?
And not that kids are animals, but I mean, no, seriously, the same concept applies, right? In that if people were to turn out their lights, there wouldn't be any kids going around to trick or treat there.
Can I make a comment?
Sure.
Please, Paula, go ahead.
So when we first moved to town, we were in a neighborhood right next to where you are, Dr. Ehrlich and Aaron, and we had people coming from everywhere because we had sidewalks and our houses were relatively close to each other. The first year I gave out 250 pieces of candy. And then I heard about downtown and Church Street and the side streets attract huge crowds. And not only from Westborough, but a lot of people from out of town go there because of the fact that, seriously, they go
I
there
believe you.
because of the closeness of the houses and because there's so many of them. And it's just always been a big attraction. So, I don't know I know some of the people that live there have made comments about not really wanting that this year, which you can understand, but.
I mean, if we were to encourage people to, go ahead.
So I've been downtown in previous years, and it's definitely, as Paula mentioned, because the houses are in close proximity to each other. But also in past years, they've done haunted houses, things that you can go in. They have amazing decorations down there too, a lot of the homes. But a lot of people congregate there because there's at least one or two different haunted houses that you could have gone into in the past. They're not doing that this year, so maybe that will reduce the crowds.
If we were to recommend that people not stock up on as much candy to give out, and so that their supplies run out and that people turn their porch lights off earlier, would that also help reduce kind of crowds and reduce the number of people that are out and about?
So unless you have an app on your phone that tells you that candy has run out, people are coming down there anyhow to, they don't know there's a problem until they've already gotten there and they're in these large crowds. That's the problem.
Yeah, but they dissipate pretty quickly, I would assume. Right? If you get to this street and let's say you either got dropped off or you walked there and you see that every house in the street already has their lights off, you're not going to keep walking down the street. You're going to turn around and go back the other way, right?
Well, that'll shorten the duration of the problem.
Yeah.
But yes.
But it doesn't, but hold on a second, guys. I don't think it absolves us of, we need to make sure that we're protecting those residents, right? I mean, circumstances.
Again, Syed, the best way for someone to protect themselves is to say, I'm not giving out candy this year. Or you just set out a platter of things, and when it's gone, it's gone. The issues around the crowding certainly affect whether, if you're opening the door and greeting people, that's going to put you at risk. And for the kids who are coming into proximity with other kids, the kids have danger amongst themselves. But, there is nobody who's going to, in the immediate moment increase their risk if they're not participating. Now, if you say, well, okay, rates go up in town, and if you live in town, then you have an indirect risk down the road. That's the legitimate concern I think we're really talking about here, because, obviously those who wish to participate and those who don't, will sort themselves out. But those who don't wish to participate are still at risk if rates go up in town. That's the concern.
Right, that's what I'm concerned about. Like
So again, Syed, I know you're concerned about it. Do you have a specific suggestion, though, of what we should be doing? Again, we're getting a few more emails. So here's one from, again, the West Street area, saying they go through 500 pieces of candy at only one per kid, and that kids are coming from outlying neighborhoods and apartments on Route 9, again, because the housing is close together. And I get that. But, I think the solution is along the lines of what Dr. Walsh has said, which is make a determination of what you're going to put out and then turn your lights out when there is no more. I'm just looking at.
Steve, do you also?
Yeah.
I'm just wondering, do you have an idea of what other towns are doing? Or have you talked about this with, like, in your community?
There's a note here again from Shelby saying some towns that are having trick-or-treating are trying to promote a 2-hour window, maybe 5 to 7 or something like that, or 5:30 to 7:30 might be appropriate. And that if we need to engage the Board of Selectmen, it's got to happen extremely quickly. Again, I think there's a limit to what we can do or should do, aside from trying to get education out to people about, what we're advising.
Yeah, the flip side to these windows is maybe you cram everybody in a 2-hour period.
That's the other. I agree with you. That's my concern. So
Yeah,
maybe the thing to do is we stick to the guidance then. We give the guidance that, as we said, it's a high risk activity, and and other points that Steve has already alluded to. This
So
is our
I
recommendation.
really do think that one of the most effective things that we could do is encourage the residents that are giving out candy to only have a certain amount of candy that they give out and keep that limited. That's going to have the same effect of having a window in place for when people can go out, because it's all going to get used up in that first hour or two. It'll also keep the maximum crowds down. I mean, I think that you stop it at the supply, and that's actually going to have all of the downstream repercussions that we want.
So towards that end, I do think, Steve, you need to touch base, or either you or perhaps town manager, but somebody probably needs to touch base with the police department to make sure that there isn't, if this is a disappointing year because lots of people have their lights out and they're not participating, I don't want there to be trouble if there are large crowds. So there needs to be, some presence, I think, of public safety that we think about.
Do we want to issue any guidance in terms of the maximum crowd size that we want? Because that's something else we could do, right? I mean, the governor's already done certain amounts at different periods in this crisis where he said that, crowds were limited to a particular size. We could issue an order similar to that and have it just in effect for, Halloween.
So the crowd size is obviously based on facility usually. So I think that's tough when you're dealing with how do you measure crowd size on the streets where you got, you know what I'm saying? I mean, usually a crowd size is per facility and you have a boundary and you can measure that stuff. As far as like a whole downtown area, I think that's tough.
I think even on beaches, they were at one point limiting groups, and so that it wasn't how many people were total on the beach; it was how many were in one particular location.
Yeah, but I mean, we're recommending people go just with their household, or maybe however we phrase it. So, to that extent, aside from our making a recommendation, Nathan, what would you propose we do?
Well, what that would do is make it so that if, let's say, there was a police presence downtown and they wanted to break up a group that was obviously larger than what we said, a recommendation that people just trick or treat in family units is very different than us saying that the maximum crowd, the maximum group size is limited to, 5 or something like that. That would certainly give more teeth to an enforcement body that wanted to enforce that.
I'm just not sure. I mean, I'm sure there'll be a police presence down there. How much breaking up they're going to be doing, I don't know if Jeff's prepared to do that. I wouldn't want to, propose that without him having a say.
I mean, from my point of view, we're looking at it from public safety point of view. And, if we issue a rule and it turns out that they don't enforce it, I mean, I think that we do ourselves a disservice by just second guessing that and then not issuing the rule in the first place. I mean, if we think that there's a safety issue with large crowds, there has to be some sort of limit that we think is too large and we don't want that to happen. But I do want to.
I don't know. I think we're getting into issues that if we're going to start doing that type of thing, that we certainly need to meet with the Board of Selectmen and the police. That's my opinion.
Yeah. I want to try and get us to some actions here. We have one that we've proposed, and I think there's a general agreement that we're going to put together an educational piece that highlights our position that Halloween is a high-risk activity. Those who rather trick-or-treating is a high-risk activity. Those who choose to trick-or-treat, here, whether you be the child or the household, here are ways that will decrease the risk, and here are alternatives to trick-or-treating that you might want to consider. That's the educational pamphlet. It should be a one-pager that the schools can then distribute. So beyond that, is somebody, Nathan or Syed, are either of you going to propose a specific action that the board should vote on?
No, but I do think Steve needs to have a conversation with Christy and perhaps with the chairman of the Board of Selectmen to decide if the Board of, and by the way, I'm saying this as a member of the Board of Health. I'm not saying this as a selectman, okay? I'm just saying this as a member of the Board of Health. I think Steve does need to communicate with Christy, make sure that if the Board of Selectmen want the Board of Health to discuss this, that we should be ready to do it next Tuesday. Would that be agreeable to the board?
Yeah, and in fact, I think something like this, if it turns out they would like to ask us specific questions, it doesn't even have to be a Tuesday. It could be sooner with, if they wanted to get things done sooner. But yeah, I'm open to meeting jointly with them. But I think that I'm also, like Syed, not willing to propose any sort of curfew or, gathering limit that we'd be seeking kind of enforcement from, the police for.
So I think, so Alan and Nathan, so our consensus is we sent out that Steve drafts a statement, sends it to us. After he gets our concurrence, he then shares the statement with Christy and the police chief and whatever. And if at that point they are unhappy, and I'm sure Christy can then share it with the Board of Selectmen. And if the Board of Selectmen then want to have a discussion with us, then I think we'd be amenable to that. Yes? Would that be a consensus of what we've just discussed? Would that be, Steve, would that work for you? Would that be okay?
Yeah, I can, we'll yeah.
Yeah, so I mean, this is an initial statement by the Board of Health. And then if we wanted a joint statement from the Board of Selectmen and the Board of Health that came out as part of these individual board discussions, I'm more than happy to, come out with a joint statement.
And actually, the third component, I think we really do need, Steve, let's make sure that that whenever we get this thing, that we share this with the schools and make sure that they're on board with whatever because trust me, I have no idea how children, I don't deal with children. So I just want somebody that deals with children to make sure that what we're proposing is, sound and sane and will be followed.
Okay, so one last piece of feedback. Again, this is coming from Shelby, which basically says, as of last week, the following communities had already canceled trick-or-treating: Leicester, Worcester, Springfield, and Groton. Then there were others, including Shrewsbury and Holden, that had timeline limits. This looks like 7 communities. The ones near us are Shrewsbury, Upton, and Holden. The others are much further away. I think it's, as you're preparing that document, Steve, where we state that the CDC considers this a high-risk activity, it is also fair, maybe there's some introductory language that some communities have already canceled trick-or-treating and others are imposing time limits. Westborough has chosen to provide the following guidance, but just letting the parents know that some communities have already canceled may affect their decision-making.
Okay.
All right, I think we have reached the end of this discussion unless anyone has anything else to say about it.
I know I'm going to be a little bit slow in responding to the turnaround of that letter tomorrow because I've got a busy morning tomorrow. But I'll take a look at it as soon as I can.
Okay. All right, we're going to move on to the health inspector's report.
I'm pulling it up.
Yeah. Just first of all, under COVID complaints, in your discussion in Mexicali,
Yes.
it sort of ends abruptly.
Oh.
I think it's also on the second section, and so I think that it kind of continued a little bit, but not quite completely.
Oh, that's
Okay.
funny. Sorry about that.
Yeah.
Yes, so they did test positive. One of their staff members did test positive after I was there, actually, and they had not been in the facility. We did do contact tracing with them and quarantine the people who should have been quarantined, and they were all set. The actual complaint where they were Worcester staff coming in did not appear to be a legit complaint.
Okay. The other question I had, it looks like Boston Market is closed. Is that permanent or is that just related to COVID, or do you know what's going on there?
I have no idea. I went to do their inspection and they've been closed since COVID, but potentially for other reasons. I don't know. They haven't reached out at all.
Okay.
I don't have anything else. Syed, do you have anything else?
Okay, those are my only questions.
I've got a motion that we accept the health inspector's report for September 2020.
I'll second that. Roll call, Dr. Walsh,
Walsh, yes.
Dr. Hashmi,
Yes.
Dr. Ehrlich, yes. Okay, we have a violations review that was submitted for us from the South Street Diner. I don't know if we're gonna have just a discussion around that.
Yeah, I was just going to put it under director's issues, but it looks like
Okay.
we're close to that anyways.
Yeah, exactly. Seeing it on the page, to me, it wasn't as bad as I had thought previously, because some of this is related to the fire or the complaint inspection where, if you take those two things out, then you've got, not the best of record, but not the worst either. So I don't know if Ray or Erin have thoughts they want to share with us, or else I'll hear what Nathan Zayed have to say.
No, I don't really have thoughts besides, I put down what we observed during our inspections. So they did seem to have an increased amount of violations in probably the past 2 or 3 inspections. One of them was a complaint. I also did a routine inspection during that last one in August. But they did, Ray had done their reinspection actually, and they had addressed all of the violations at that time.
One of the things that they have recurring is the PIC knowledge. And so if you could just briefly refresh me on what that means and then how they would have solved that by the next inspection.
Sure. So when there's a priority violation that we find, which is typically a food contact surface cleaning issue or a temperature issue, a serious issue, it also triggers a violation about PIC knowledge, which is person in charge, and it just shows what we write down is that they're not demonstrating knowledge, and they need to do something to refresh that. So often we ask them to retake their food protection manager certification or allergen awareness.
Okay. Yeah, I thank you for pulling this together for us. A lot of times we need this history kind of right in front of us so that we can make decisions. And sometimes I think that when we pull it all together, we clearly have actionable evidence that we need to do something different. I think, as Alan was saying, this is a case where it's not a great track record, but it might be something that we kind of linger at this level and try to encourage them to do better. But I'm not sure that putting them on probation is necessarily going to turn them around at this point. And I don't know, maybe you guys feel differently.
Oh, I think it might turn them around. I just don't think it's warranted. If you said, well, how many facilities do we have in town that get reports like this, and how many of those wind up on probation? I think most of them, it's okay. And again, Ray or Aaron, if I'm wrong about that, now's a good time to let me know.
I don't think you're wrong about it. I'm looking at it. Just when we go out there, it's the same thing over and over. Like Nathan said, it's always something with the person in charge. The reason with that is when they redid the food code, they wanted to make the responsibility more for the person in charge, because over time we'd write down the same thing and they'd say, oh yeah, I'll get to it. So now that's why they put that in there, is so that we can say, hey, look, your person in charge should know that your food shouldn't come out of the cooler at 57 degrees. It should be below 40. And this is where it's going to get somebody sick. And I just think looking back and looking at, they are a troublesome spot, but sometimes it's very good, sometimes it's very bad. And I just think sometimes it's, getting them that push in the right direction is what we need to do. And I just don't know. I mean, the next report we go in there, it could be terrible again. And I just don't know where we go from this. We've had other places, some of our places that were on probation are doing better than some of these reports. And they're still on probation.
So I guess, well, we should address. But I guess my feeling is, if you do get a worse report, we can revisit this. I just feel like, honestly, what I feel like is the problem here is less what their reports are than the fact that it seems like half the time you go there and there's an issue, somebody's giving you crap and they're not trying to work with us to make it better. So, but again, I want to just try and deal with the facts and not let those other things necessarily affect my judgment at this moment.
Yeah, I mean, the August report is particularly bad. There were 15 total, but
yeah.
3 priority foundation, 3 priority violations is way too many. Having 6 of those priority class violations are a lot.
And I agree. And that's why I think we asked for, the report. So we'll see what it looks the next time. And maybe if it's the same or worse, it will warrant taking action, but I just don't feel ready to do that tonight.
Okay. I'll support that.
All right, then I think we can move on to director's issues.
Okay, so first thing is town meeting is the 7th of November, if you didn't know. And we actually do have a Board of Health article on there, if you didn't know, something that's rare for us. So we're article number 1, and it's.
We'll get out early.
Yeah, it's for bills. We were billed for services after July 1st. So we can't pay bills in the next fiscal year for the previous fiscal year. And this was a bill from Harvey's for, they recycle our electronics. So we have to go to town meeting to get money for that. So that's what that's about. Nothing huge, but you should just be aware of it.
Yep.
So that's that.
We should take a vote and say whether we are in favor of Article 1. And I'd like to make a motion that the Board of Health is in favor of Article 1.
I second that motion. Any discussion? We'll have a roll call vote. Dr. Walsh?
Walsh, yes.
And Dr. Ehrlich, yes.
Thank you.
Okay. So right now we've been tasked with doing our fiscal year 2022 budget. As you know, we cut hazardous waste day from the budget this year. My intent is to put it back in. I just want to make sure that you're both on board with that.
Yeah, I think it's a good idea. I think it's a good idea.
I think not only is it a good idea, but you might need to budget a little bit more than you would in a typical year because we had a year that we didn't have it. Not twice as much, but you might be thinking, 1.3, 1.5 times what we would normally have.
Okay.
I agree with that.
All right. So as you may or may not know, we've started food composting at the transfer station. Where people can bring their kitchen scraps and put them in a bin, and they go to an anaerobic digester to be composted. And Sustainable Westborough has reached out, and they want to. And this is in conjunction with DEP. Purchase 100 compost buckets. These are buckets that have lids on them that people can use in their kitchens that will contain the food waste, the splashes, all that type of stuff. People can bring the food waste to the dump in these buckets. They're $6 a piece. And I was on board with paying for that. We get a sustainable grant from DEP pretty much every year for $1,250, I think it is. So I typically use that grant to help pay for the cost of hazardous waste day, the flyers. But this year, since we didn't have any, so I'll probably have another 600 we could use on that afterwards. The only reason I only want to do 600 right now is although I've been told we're getting the grant, we haven't actually got it yet, but this is an opportunity to buy these buckets and kind of do a kickoff, and Sustainable Westborough is going to distribute them to people. I guess they're going to be down at the Harvey's facility to do it. So I just want to make sure there was no, objections to doing that.
It would be a really great opportunity if the buckets had some sort of labeling or messaging saying that it's for, Westborough composting or something along those lines. I'd hate to have this turn into just a bucket with a nice lid that then people take and just, are using for something else without a reminder what it was supposed to have been used for.
Yeah.
So I agree with Nathan about that. And then the other thing is, while I understand the idea of handing it out at Harvey's, part of the notion here is that this is for everybody in town. In other words, you might choose to do this as part of your recycling, if you're one of the people who has Tidy Town, but also bring stuff to either get recycled down there.
I think I talked to Katie about this today. I think, this is just kind of a kickoff thing. I think at some point we'll probably incorporate it into people coming and getting the dump stickers, things like that. So this is just the first pass trying to get some positive, advertisement about it. As far as what's on the bucket, I think, later, I don't know if that's possible this time, but I think, this is something that we're just trying to get off the ground and do. I think we can probably look into that in the future as far as, maybe labeling it, I don't know. I have to look into all that.
Okay. And I would say, I agree with Alan that, if we had a set of buckets to put toward this program, certainly having a large number of them go through, Harvey's makes sense. But there might be other places or other avenues that we want to distribute. Even this initial set of, if it was like, 100 buckets or 600 buckets, maybe Sustainable Westborough has some distribution arm. I know that they've been active with people that have been expressly interested in composting and that sort of thing. It might be a mechanism to connect buckets to the people that are actually going to use them in a way that might not happen if you just handed them out at the dump.
Okay. Yeah, I think this will evolve somewhat, the whole program as time goes on. Again, we've only been 5th. So,
Yep.
okay. And the last thing, so our annual flu clinic for children, I'm trying to get that on the books right now. Typically the state gives us doses based upon our usage over the past few years, and we only typically vaccinate about 90 kids a year. I was able to get 200 doses, so that's double what we usually do. I'm looking at the second week in November right now, and what we're going to do is have pre-registration. We're going to do it over, my plan right now is to do it over a 3-hour period, have pre-registration for 15-minute blocks so we can control people coming in, have more nurses than usual to give the shots. We don't want people hanging around. And I think we should be able to get people in and out as long as, they comply with, the times they're given. So I'm still kind of, organizing this logistically, but, and if we run out of 200, then we can get more and might have to have another clinic. I don't know what the demand is going to be. There is plenty of vaccine out there for people to have their kids vaccinated, but, so this is where we're at right now.
Did you do the prep mod scheduling, or is that something different?
This is something different. Prep mod is, all we need is a registration app. Prep mod is much more, it's complicated, and maybe for next year, but they're rolling that out. We're just not prepared to invest the time that's needed to learn that right now. So we're just going to use a simple registration program, and that should do us for this year.
Okay.
And I think that's it for my issues.
All right. I guess we're going to have to go to Paula's issues. So you're on mute, Paula.
I don't know if you have any issues.
Do I have any issues?
Yeah, don't you want to schedule the next meeting?
Yeah, that would be my only issue.
Yeah, that's what we're up to.
Okay, good. Go for it.
Does the 17th work for you, Alan?
I'm just double checking.
When is Thanksgiving this year?
The 26th.
Okay, so it's the week before.
17th looks good.
Yeah, that works for me.
Okay.
Okay.
All right, motion to adjourn?
Yeah, I'll make a motion that we adjourn.
Second? I'd like to do it by acclamation, but go ahead. Dr. Walsh?
Walsh, yes.
Ehrlich, yes. Okay, thank you all. Long meeting tonight, but I think that the conversation and discussion about Halloween was very important for the town. So thank you all for your input.
Thank you.
Have a good night.
Good night.
Right.